What are the effects of scoliosis? Diagnosing a scoliosis means an unnatural sideways spinal curvature has developed. And this curvature has a rotational component, meaning it's twisting. And the twisting component is what makes this a three-dimensional condition. And normally the rotation is into the concavity of the scoliosis. Part of the diagnosis also involves classifying condition-based key variables based upon the individual patient as they're presenting themselves. Scoliosis, unfortunately, is a progressive condition, meaning it's more likely going to worsen over time. And normally as the curve worsens, so will the effects it's causing on the individual patient or individual person. So initially, scoliosis is classified. And the way you classify it streamlines the treatment process and also informs us in crafting a customized treatment plan that will be the most effective in actually delivering a reduction in the scoliosis. The key variables tend to be patient's age, the condition type, the severity, and the location of the scoliosis. The effects of the scoliosis are determined by these key classification points and, of course, the severity. Now, the severity is normally determined by something called a patient's Cobb Angle. A Cobb Angle is a measurement that's taken on something called a scoliosis X-ray. The higher the patient's Cobb Angle, the larger the size of the unnatural curvature, the more severe the scoliosis is, and the more likely the effects are to be. Now, when we look at these categories of severity, understand that these severities are comparing to something called surgical intervention. So these are considered surgical categories. So a mild scoliosis is too small to consider surgery, but mild curvatures still could have significant effects on the body. Same thing with moderate. When we look at severe scoliosis is when they start consider surgery as an option. So the only thing I understand is that these categories may be misleading because they say mild scoliosis. You think it's not a big deal, but where the scoliosis is diagnosed now doesn't necessarily mean where it's going to stay and doesn't mean it's not causing effects. So mild curvatures are when Cobb angles are between 10 and 25 degrees. Moderate scoliosis cases are diagnosed between 25 and 40. Once you break 40 degrees, this is where it's considered severe. And then I like to use a fourth category, which is called very severe, and this is when you break 80 plus degrees. When we look at scoliosis severity, is scoliosis pain or pain associated with the size? Now, unfortunately, there is no size of curve, and this is when you're going to start to feel pain. So like at 30 degrees, you're going to start to feel pain, or at 50 degrees, you're going to start to feel pain. Pain is associated with adult scoliosis, not childhood scoliosis. And this is a result because as curves progress in the adult form, they become compressive. And this compressive nature of the scoliosis progression, it's what leads to pain because it's affecting the nerves and the tissues and the muscles around the spine. Now, children can experience pain as a result of their scoliosis, but it's normally mild pain at the site of curvature, and it normally resolves itself with a little bit of rest, where pain for adult patients could be very wide in its presentation. It can be anywhere from mild pain to stiffness, to a lack of endurance, some fatigue, to severe nerve pain, to debilitating pain. So therefore, the severity of pain associated with an adult patient could be very extreme from one side to the other. But we do know as curves progress in the adult form, it's more likely to cause pain. And it's not necessarily related to the size of curve that the person has, but how much they progress. So a curve progressing from 10 degrees to 30 degrees in an adult may cause significant pain because it's 20 degrees of progression. And even though it's only a moderate scoliosis, where somebody with a 50-degree curve as an adult that's never progressed any degrees may have very little effects because the curve has never compressed in the adult form. Now, the main effect of scoliosis on children is not pain. Like I said, they may have some mild pain, but the most likely thing they experience is postural deviation. We see uneven presentation of posture. We also see this in adults, but normally they know they have this, but so it brings on treatment in an adult patient because as they're worsening in the adult is pain. When in the child, they normally don't experience pain. Normally they see something. They see uneven shoulders. They'll see uneven rib arch. They'll see uneven legs that appear to hang at different lengths. They'll see an uneven waist or hips. And this unevenness leads to uneven forces which disrupt body symmetry, and what I like to call it affects the outline of their torso. And this outline tends to present itself in a posture evaluation. We do not expect kids to have severe effects in terms of pain, which lead to malfunction and prevent them from doing things. And very often parents may push or may neglect the seriousness of scoliosis and how it could progress during growth, because as it's progressing, they don't experience discomfort or pain. It's normally just worsened posture. So if we see any type of postural misalignment in an adolescent, there's no normal reason for that to happen. And especially if it's worsening, that's a sign that the curve is worsening. And we don't expect kids to feel pain, but the effects are going to happen when they go into the adult stage and the curve continues to progress in the adult form. And now they start to experience pain and malfunction. So we know scoliosis has a wide variety of condition variables that can affect people at different ranges. And there's no indication that's saying, okay, at this size, you're always going to feel this. And if you're at this number, you're never going to feel this. It's unique. It's unique to that person and how it affects them. But we do know that as curves worsen for that person, it's more likely to affect that person in a negative way. Like I said, in adult patients, pain tends to be the problem as it progresses in the adult form. In children, posture tends to be a problem as it progresses in the adolescent form. But in either scenario, as the curve worsens for that person, it's more likely to cause problems for that person. But it's not cross. It means that you can't compare somebody else to another person because it's unique to them. Each one of these condition variables that are associated with that person affect how the scoliosis is affecting them, but it also helps us customize how to reduce the curve. But the best way to minimize how scoliosis affects patients is to reduce the scoliosis and treat it proactively. Smaller curves always respond better to treatment than more severe curves, so proactive treatment always produces a better result. So here at Scoliosis Reduction Center, we're big proponents in early detection and early intervention, not early detection and then just watch and see what happens. And then if the curve worsens and it becomes more severe, then consider treatment options. We recommend treating early. This produces the best possible results. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.